www.healthcmi.com. Acupuncture continuing education online today. Acupuncture Postpartum Depression Success. Published September 4th, 2019. Simply go to healthcmi.com, click on news, and look for the article entitled Acupuncture Postpartum Depression Success. This is a very serious topic and often misunderstood. First, we'll take a look at the article. Let's talk a little bit about this topic in depth after that. Acupuncture alleviates postpartum depression. In a recent study by the Traditional Chinese Medicine Hospital in Hainan Province, acupuncture was found safe and effective. The study compared standard care, which is psychological intervention and medications, to standard care paired with acupuncture for 80 women diagnosed with postpartum depression. And again, sample size of the 80 women is based on funding for the research. So, of course, we would like a larger sample size of thousands of women, but 80 were funded in this study. Now, the standard care group measured a 67.5% total effective rate, so regular psychological intervention and medications. Now, the group that had standard care plus acupuncture had a 90% total effective rate. So when you add acupuncture into the postpartum care protocol, you get an enormous bump. That's over a 20% increase in positive patient outcomes. And this is broken down into exactly how they got the results. So they give the acupuncture points. They also used Jiawei Xiaoyao Wan, a special herbal medicine, which is commonly used within Chinese medicine. The great Shahua Li even called this the number one herbal formula of the women's medicine department. And she is considered, of our time, one of the greatest OBS-GYN acupuncturists, not only of our time, perhaps in all of history. And I would concur that Jiawei Xiaoyao Wan and even standard Xiaoyao Wan is one of the most important formulas, not only in women's medicine, but perhaps in Chinese medicine. So they did an herbal medicine acupuncture protocol in addition to standard protocols and got great results. And this is not surprising for a licensed acupuncturist because this is standard in an acupuncturist practice. So if someone's been practicing for decades and you tell them this, they'll say, yeah, no kidding. But why? Why is this so standard? Why is this considered so normal to a licensed acupuncturist and people familiar with Chinese medicine? Because we know that anytime the body is stressed from, let's say, a trauma, chronic illness, physical or mental illness, or even blood loss or strain or exhaustion after birth, that there can be severe psychological and physical consequences. So the postpartum phase, there is an exhaustion. It takes a lot of energy to make a baby. Acupuncture is very famous for treating nausea, for example, in the first phase of morning sickness. And there are many kinds of morning sickness in Chinese medicine. But a standard morning sickness where it's just a woman is making a baby, basically. And it takes a lot of energy. Now, we say normally the stomach qi, or the function of the stomach. You don't need to think in terms of the word of qi, but think of the function of the stomach itself, which is what the word is referring to, is to push food downwards, is digestion, right? And things come into the stomach from above and move through to the intestines, correct? If the metabolic energy is being used to make a baby, things we say come back up because the function of the stomach is no longer pushing down. We say rebellious stomach qi, and you would say that the organ itself and all the internal organs are a little preoccupied because not only creating a baby and then all through childbirth takes a lot of energy. So this is why there is nausea, because we say the energy is coming back upwards. It's going to be nausea, vomiting, this type of thing. So we often use herbs or acupuncture to help what we say the qi descend, or of the function, the neurologic function of the stomach to push downwards again, and that relieves the nausea. So something like pericardium 6 is used. It's a point on the wrist. It's somewhat miraculous and works instantaneously. In the case of postpartum depression, it's a little more sophisticated what we need to do. We need to nourish the qi in blood and help with circulation. In other words, think of it like a subclinical anemia. Think of it as a type of exhaustion. So the body needs nutrients, which are in the herbal form, and the body needs certain types of stimulation for the internal organs, which is in the acupuncture. And we get the results. It's a serious disorder. Look, psychological medications are Band-Aids. And they may be important Band-Aids that can prevent suicidal tendencies. I'm not understating the importance of a Band-Aid. I keep a whole lot of Band-Aids in my medicine cabinet. But we need more than that. We need to get to the root of the problem, because in Chinese medicine, we look at treating any disorder as a treating of the symptom and the root cause. Symptom and root. How much in your treatment protocol are you treating the symptom, let's say with psychological medications, or the root cause, which is deeper, which is exhaustion? Postpartum depression is worse in people who lose a lot of blood during delivery. But it is a form of internal exhaustion, and the body needs to recover. So this is a nourishing, strengthening, and restorative treatment after something that has happened that has put a strain on the body. And that can affect the psycho-emotional complex, leading to severe depression. So this is a marriage of both psychological and physical components. They are one and the same. So we can't just say it is merely a psychiatric illness limited to someone's emotions and feelings. When in Chinese medicine, we see emotions as physical events. Here, due to the exhaustion, and with restorative herbal medicine and with restorative acupuncture, restore the mental health. We know that acupuncture in other research, and if you go to healthcmi.com, click in the news department, there is a lot of it. Acupuncture can restore mental health, and we get the positive patient outcome rates from the subjectives. But we also know from objective measurements it restores normal biochemistry, both peripherally and centrally, that is, in the brain. We know from MRI studies that acupuncture can restore the default mode network, which is an area of functional connectivity of the brain, so that certain areas light up and certain areas deactivate per normal events like relaxation or doing tasks. We know that acupuncture can help restore the default mode network when people go to rest, because that can also be disturbed. And acupuncture has a restorative function, basically allowing, when people are at rest, to certain areas of the brain to rest as they need and certain areas to activate as they need to be. And that is a pattern common across all humans, and mental illness is a pattern where that is out of balance and not happening properly. To explain the default mode network very simply, if someone is at rest, again, you're not grabbing a pencil and trying to write, you're not trying to drive a car, simply not thinking about any task-oriented behaviors. That's when the default mode network exists in the brain. And so the brain has certain areas at this point that are active and some are not active. Unfortunately, when people have mental illness, the areas that are supposed to be active when at rest may not be active or hypoactive, and the areas that are supposed to deactivate at rest don't deactivate. So that pattern is upset from different global or hemispheric regions. And acupuncture has been shown to restore that DMN, that default mode network. This is one of the ways which acupuncture addresses postpartum depression, by getting a reset and repatterning the brain signal so that the metabolism in the brain is correct again. Once it's off, it's hard to get back. That's the problem. And acupuncture really is a reset button. Sometimes I think of it like my computer hitting a reset on my computer. I just reboot the computer and it feels a lot better. Acupuncture is similar to that, which is why during an acupuncture treatment, people often feel a sense of deep relaxation. They may even fall asleep. And when they wake up from that, they feel very refreshed. It literally is resetting the default mode network, or at least attempting to. Not one visit will necessarily achieve this. I will not say that this is a simple procedure to restore that. This is hard-fought gains by people who studied and devoted their lives to Chinese medicine to get the job done for their patients. It's not as simple as taking a pill. Someone has to make a diagnosis and then apply the treatment protocol. However, over time we can get the job done, and a lot more quickly than if someone doesn't get this done. For postpartum depression, I don't think there is any excuse with the amount of research, not just this paper, but many papers for many years, including meta-analyses. There is no excuse for not having this as a standard protocol. So people can live for weeks, months, or even years with postpartum depression without getting what they call in this paper the, quote, blood-enriching and heart-nourishing treatments. Because we get the results. Every acupuncturist who works with this knows this and sees the results. And the results can be quick. And there's a lot more that goes along with postpartum depression. We see it as a pattern. There can be memory loss, which is part of what we call the blood deficiency. There can be headaches as a part of the lack of what we call qi circulation, or what you would call an imbalance of parasympathetic tone from the autonomic nervous system. Keep in mind that the ancient language that we use can be understood in modern terms as well. So when we say something like the spleen qi is low, think of your metabolism is low or your thyroid function is low. There's a correlate in modern terms. When the terms were originally created, we didn't have these modern terms, but we do understand them in modern terms as well. So if you're interested in this topic, go to healthcmi.com, click on news, and look for the article entitled Acupuncture Postpartum Depression Success. What you will find in the news department is a lot of research on how acupuncture not only helps people with depression due to postpartum, but also depression due to many other causes. Acupuncture alone, or herbal medicine alone, or talk therapy alone, pharmaceutical medication alone may not be the answer. Dietary modification alone. Lifestyle things like helping with sleep or exercise. No one component may be enough. But together, they can work together to get the job done. Acupuncture and herbal medicine has a tremendous over 2,000-year history of treating this. And I would say in terms of the modern writings of Chinese medicine, it practically fills libraries. Actually, it might fill libraries when you think of all the clinical write-ups. It literally would fill libraries of how acupuncture can treat postpartum depression. So this is something that is deserving of attention, because the postpartum depression can be very severe. And think of what a terrible time this occurs at when a woman has a young child. Now, especially if it's more than the first child and they have a family to provide for, this can be disabling and crippling to the entire family. So there is widespread issue here. And then that can exacerbate and aggravate the condition itself by lack of sleep or inability to provide for the family. A lot at stake here. So, no doubt, adding acupuncture to standard protocols is going to get a lot done. Thank you for listening. www.healthcmi.com